New childhood obesity guidance raises worries over the risk of eating disorders. Eating disorder treatment specialists are sounding the alarm over new guidance from the American Academy of Pediatrics advising doctors to treat obesity earlier and more aggressively, which they say could lead to eating disorders. We run the risk of doing significant harm to kids who are 6 or 8 by telling them that they have a disease, obesity, simply based on their weight status, says Dr. Kim Dennis, a certified eating disorder specialist. Eating disorders among children and adolescents rose dramatically during the pandemic, and the risk of developing an eating disorder is higher among patients who've been diagnosed as overweight or obese and patients who've engaged in dieting. What does the guidance recommend? The primary recommendation in the new guidance is intensive health behavior and lifestyle therapy, which entails coaching on nutrition, exercise and behavioral changes like role modeling by parents. Supporters of the new guidance acknowledge that it will be a while before this type of intensive therapy is widely available, though there currently are other, more accessible alternatives. In addition to therapy, the AAP now says doctors should offer weight loss drugs to adolescents diagnosed with obesity at age 12 or older and should evaluate teens who are 13 and older with severe obesity for bariatric surgery. Why are eating disorder specialists concerned? Many eating disorder specialists don't believe that obesity should be classified as a disease in the first place because it puts an explicit and misguided focus on weight rather than health. That opens the door to reinforcing weight stigma and preventing patients from receiving proper care. Medical schools generally provide little training on how to identify and treat eating disorders, meaning pediatricians may not be able to identify an eating disorder until it's advanced, especially in larger patients. Doctors should treat problems that are linked to unhealthy weight gain and habits, but the focus needs to be on treating specific health issues, not on weight and weight loss. The specialists NPR spoke to were particularly concerned about the new recommendations for weight loss drugs and surgery, given the limited data on the long-term effects of both for children and adolescents and the potential for these treatments to disrupt patients' relationship to food. For instance, when adult patients stop taking the class of weight loss drugs recommended in the guidelines, they often gain the weight back, which means kids might be on the medication for the rest of their lives. They also said there's a risk, thought to be rare, but likely underreported, of disordered eating after bariatric surgery. Monica Ostroff is executive director of the Multi-Service Eating Disorders Association, a treatment and advocacy center, and an eating disorders specialist. She and others have treated patients who developed eating disorders after bariatric surgery, some of whom had the surgery as teenagers. Bariatric surgery completely changes the way that you can nourish your body, Ostroff says. How the AAP is trying to address these concerns. The guidelines acknowledge obesity has complex causes outside a person's control, including genetic, environmental and socioeconomic factors. Some children are diagnosed as overweight or obese and are otherwise healthy, but more often than not, patients have at least one health problem related to their extra weight, whether it be medical or psychosocial or emotional. What's next? And what can parents do? The AAP plans to work with the Academy for Eating Disorders and the National Eating Disorders Association to develop more resources and training on evaluating patients for disordered eating. For now, parents still have to navigate conversations with their kids and make decisions about their health. So what can you do? Experts agree the goal is to make kids healthy, not skinny. Small, positive changes, think introducing vegetables and movement that children enjoy, can improve a child's individual health risks regardless of whether there is weight loss. Steps like eating meals together as a family can reduce the risk of both eating disorders and obesity. In short, focusing on your child's whole health, including mental health, is the best strategy for trying to avoid serious problems down the road.